Hello everyone, Dr. Cox here. I'm an oculoplastic surgeon based in Boulder, Colorado. I want to talk about skin health. Although I'm a highly surgical practice, I get a lot of questions from patients regarding skincare, and I like to use the term skin health because it is about creating a healthy skin surface and beneath the surface of the skin. So I like to think about it of longevity through the different decades. Here's my kind of philosophy. If you are 25 years old or less, roughly, then you have a lot of skin integrity, meaning collagen, elastin. These are skin proteins that give the turgor and elasticity to our skin. So you're pretty much set there. It hasn't started to decline a lot yet. So your main concern should be to protect the healthy skin that you have. And by protection, I mean wearing sunscreen to protect from UV radiation, which we know can cause cumulative damage and high risk of skin cancer over time. And also moisture, especially depending on the climate you live. I used to live in Florida, it's very humid, so the moisturizer you use may be a little different. Living in Colorado now, very dry, so a moisturizer is, and protection are things I think if you're 25 years or younger. You got healthy skin already, let's keep it healthy. Then, when you get into the age range of say 25 to 45, where you start to lose those natural skin proteins, collagen, elastin, I think of it like the integrity of the skin, and by integrity I mean structural integrity. So you may want to start doing things that help create a homeostatic balance. If you're losing something, what can I do to kind of like mitigate that on the seesaw scale of balance and maintain that? That may be topical things like adding retinol. That may be topical things such as acids for the surface of the skin. And then you may get into things that really are collagen or elastin producing or stimulating, such as microneedling, a laser. Those are your powerhouses for the structural integrity of the skin and the surface of the skin. So 25 to 45, start losing the structural integrity, the surface starts changing, so you're going to be doing things to help maintain a homeostatic barrier and structural integrity. Now, 45, 65, and plus, you've theoretically lost more structural integrity. The surface is going to change even more and be susceptible to sunspots, redness, and that's where you continue on that same journey of protection, sunscreen. That's the base, moisture, in-office punctuated treatments where you're trying to stimulate that collagen, elastin, skin protein production, which again is the structural integrity of the skin. So you may have to do a more powerful treatment if you're 45 plus or 65 plus, or more frequent treatments depending on your goals. So that's just kind of my philosophy on skincare and how I think about it. You don't have to flood your mind and be overwhelmed, but you do have to think. You have to think of, what are we trying to do? Protect and maintain. So hopefully this is helpful, and thank you for your time.